So, Tom, how do you see FolkTime growing in terms of new programs for youth and for veterans?
That's a really great question because those two populations are at the top of our list for people to serve. We have a very strong interest in creating programs for Iraq and Afghanistan veterans. We currently are working with the VA and do provide a program for Vietnam-era veterans who come to our Northeast Portland program. But what we're interested in doing with the younger vets is creating a peer-to-peer support. So having veterans come and go through some training such as intentional peer support, mental health first aid, and then that gives them the ability to reach out to another vet who has similar life experiences. As far as youth, we currently don't serve anyone under the age of 18, and we see a real need to create a program for youth who are just being diagnosed with a mental health problem or difference. So young people from the age of about 14 to 22 or so would be the parties we'd be interested in. And what we'd like to do is create a socialization program. So a place for them to go, to have friends, to make a meal together, probably early evening, to do activities and give each other support.
Fantastic. So in the larger scope of things, how is it that you would say FolkTime is different from other mental health organizations?
Well, we're similar to some other organizations in that we're peer-run, which means that the people who work at FolkTime and the people who attend FolkTime, who are known as members, really make the decisions about how the program operates. So we're not a treatment program. So there's no medical records, there's no clinical analysis. Gotcha. People come to our 3 socialization programs just to enjoy themselves, have fun, make friends, and know that they can just be themselves. The other thing that's different that we're doing that's new for us, but it's also a first in the state of Oregon, is that we have trained peer support specialists working in 3 behavioral health clinics in partnership with Clackamas Behavioral Health. So 2 of their outpatient clinics and also their Centerstone walk-in crisis clinic. And as far as we know, that's not happening in any other clinics in the state of Oregon.
Very cool. So is that what you refer to as peer counseling?
Yes, that's peer counseling. So peer counseling is really peer support. It's peers who have been trained, people who self-identify as having a mental health difference, who have received training in something like intentional peer support, mental health first aid. There are other state-approved curriculums as well. And they're available in the clinics, and oftentimes clients attending the clinics say that it's the peer support that makes the big difference.
Yeah, I would imagine having someone that can speak from that specific point of view has got to be helpful.
We had one therapist in a report mention that a woman who was making visits to the psychiatric unit weekly had not made one visit to the hospital in 5 months since she started seeing a peer.
Wow. That's really amazing.
So it's not only do people have a higher quality of life, but this is very significant in terms of cost savings for in healthcare reform.
Fantastic. Well, thank you so much for your time, Tom.
You bet. It's been a pleasure.